I'm Dr. Robert Stanley, also known as the Smile Engineer, because prior to going to dental school, I got 3 degrees in engineering. And then I wanted to be like my wife, who was already a dentist, and I went back for dental school. I practice in Cary, North Carolina, and I practice with my wife here in Cary, North Carolina. And what we're going to do is we're going to create a small video series for you, answering a few questions that people ask us a lot, so that it would be very helpful for you. What we do in our office is we run a comprehensive practice, which means that you don't have to go all over town to get services rendered. Oftentimes we can manage all of the situation right here in the office, which is very convenient for you and your family. And we bring a different perspective. Because of the engineering background, aka the Smile Engineer, when we do things like dental implants, we don't do them without understanding the mechanics. And that is really, really important, because the vast preponderance of dental implant complications are not biologic. They're mechanical. In other words, the screw breaks, the screw loosens, the implant breaks, the crown breaks, the cement breaks. These are all breakage of mechanical things. And being a mechanical engineer, it helps me to design custom solutions for you that will drive those risk factors down so that you can have a long-lasting solution and a beautiful smile for a long time. So I hope you enjoy this video series and watch through to the end. A dental implant is a structure typically made out of titanium that replaces the root of a tooth. The root of the tooth is down underneath in the bone, and you can think of it as a foundation. And what happens is we place this root structure called a dental implant in the bone locks onto that. That usually takes about 3 months to happen, and then you get the top. So if you have a foundation on the bottom, the house goes on top. What's the house? The house is the crown, the tooth, the part you really care about. Unfortunately, you have to add the foundation in order to get the crown, right? But the implant is the foundation, not the tooth. So they usually come in 3 parts. The bottom part, there's a middle part that allows us to customize things for you, and then the crown, which is the top part, which is what you want. But you won't get that typically until 3 months, unless it's in the front of your smile. If it's in the front of your smile, we're going to do everything we can to give you a tooth that appointment. Why? Because you have to go about your life functioning, and you don't want to walk around missing a front tooth. So if you have a front tooth that's missing, you kind of got to have a tooth to look good, okay? In the back, no tooth in the back. It would increase too much risk, and it's not necessary. So in the front, you're going to get a tooth. In the back, you're just going to get the implant and let that heal, and then get the tooth later. Anyone who's missing a tooth or is in the process of losing a tooth is an excellent candidate for dental implants. So if you have a missing tooth in a healed location, all you would have to do is be assessed by a trained professional to determine if you have enough tissue there, enough bone surrounding that area to get a dental implant. If you are in the process of losing a tooth, so you have an infection or there's been some trauma, like an accident, maybe a sports accident or a car accident, and the tooth has to come out, you're also an excellent candidate. And in fact, the vast preponderance of the implants that we do in our practice are actually immediates, which means the tooth is coming out and the implant is going in right away. When getting an immediate implant, which is when a tooth is coming out and an implant is going in right away, there's 2 ways to proceed. One is to put a temporary tooth on it at the time of the procedure, and the other way is not to. Now, typically, if we're working in the back of the mouth where no one can see the implant, we don't put the tooth on the crown on the implant. And the reason is it creates too much risk. If we're in the aesthetic zone, which is the front, and you need to have a tooth to go to work and live your life, typically we do place an implant and a crown all in one short few-minute procedure. If you're missing a tooth and you're looking for tooth replacement options, nowadays we have advanced technology that allows us to print solutions in our office while you wait. Now, those solutions vary in cost and the investment, as well as in their ability to deliver a solution to you. So let me explain. I can give you a very inexpensive tooth replacement option called a unilateral partial that would be a tooth on a piece of plastic that kind of slides in the mouth. Now, it's inexpensive. We can do it very, very fast. But the problem is it doesn't work very well. As you can imagine, if it's just in the mouth being supported by the adjacent teeth, it doesn't have a lot of rigidity. At the other end of the spectrum, we have a dental implant. If we place a dental implant, after it heals, you can chew anything on it. Steak, corn on the cob, apples. It can quite honestly be the strongest tooth in your mouth after it heals. So, and in between, we have the old way of doing it that we used to do a lot of, which was a bridge. So what we would do is put a crown in front of the missing spot, a crown in the back of the missing spot, and then in between that missing spot where the tooth was missing, we would bridge across with a fake tooth. The problem with the bridge is just like on the highways, debris gets up underneath there, under the bridges, and it's hard to keep clean. It's not that you can't do it. It just means that you have to put a lot of effort into doing it. So as long as you're diligent, you can keep it clean. If you're not, then the long-term survival rate of a 3-unit bridge is not terribly great. Oftentimes people come to me and they're concerned about the process of getting a dental implant. And I want to let you know it's really, really simple. The first thing we do as a clinician is simply gather records. We need a bunch of information, including some scans and some pictures, to determine the best course of action. From there, we put together a little bit of some behind-the-scenes surgical guides and such, and then it's time to do the surgery. The surgery for 1 or 2 implants usually takes between 4 and 12 minutes, and if you're doing a full arch where you're getting a whole new set of teeth, it typically takes about 1 hour. So the procedure is very, very efficient, and the post-operative recovery is amazing. You probably wouldn't miss any work at all with a onesie-twosie, and I'd be surprised if you missed anything, even with full mouth. When getting ready to go in for a dental implant procedure, it's important that your overall health be in a good state coming into the procedure. So if you have active infection, it's always a good idea to work on driving that infection down as much as possible before the procedure. If you have a full arch that's being done, like an all-on-X full mouth kind of solution, then what we're going to do is we're actually going to consult with your primary care physician to make sure that your overall health is healthy enough to undergo that procedure. When patients come into the office, it's very important to understand that everyone has different needs and constraints. So each and every single case that we do is customized for that patient. It's not a one solution fits all kind of things. It is literally customized from the bottom to the top for each individual case. Sometimes people have constraints with insurances, sometimes they have constraints with finances, sometimes they have constraints with time. Sometimes they have constraints with fear. And what we do is we address all of those concerns up front, figure out exactly what the concerns are, and then figure out ways to solve those issues so that we can deliver an amazing solution for you. In the old days, before the technologies had gotten to where they are today, there was only one real way to get a dental implant. And that would be the doctor would look in the mouth, look to the bone, and place the implant in the bone at the best of their capabilities. But now that we have 3-dimensional data that allows us to plan a case on a computer, we can actually use a 3-dimensional printer to print a surgical guide. So a surgical guide is like a template. And so if you do work in the garage and you wanted to make repetitive cuts, you would build a jig or a template to do that. If you were working with clothing, you might make a pattern in order to make your final product. And in dentistry, when we are doing implant surgery, it's very, very important that the implant goes in the right location and it's the right size. And the way we do that is through the use of a surgical guide. And I cannot express to you enough that if you are in the market for a dental implant, you definitely want to use someone who's using a fully guided system. And that means that they build a surgical guide off a virtual plan that allows them to place the implant through the surgical guide. This will ensure that the implant goes within a couple hundred microns of the virtual plan, which is really, really important when it comes to longevity of the implant as well as your aesthetics, how you look. Normally, the records gathering process takes anywhere between a few minutes to a few hours. It really depends on the situation. So if you were coming to us with a tooth that had been avulsed. It had been knocked out of the mouth because of trauma. It's quite possible that what we would do is we would expedite that planning process to try to get to a solution faster than if you came to us with a spot in the mouth that's been missing a tooth for a long time. In that case, we might take a day to analyze the data at the leisure in the evening, maybe with a cup of coffee, and kind of look over all the details and take our time. But it really comes down to the situation. So if you need it fast, we can actually accelerate it. And it's not an acceleration that takes away from the diligence. It's an execution matter, and we just put other things aside so we can execute it all together. But if you don't, then we just say, hey, we'll give you an answer tomorrow. And that's typically how we manage the treatment planning process of dental implants. While dental implants are healing, there are a couple of key things you need to know. Number one, you can't put any forces on the dental implant. If the dental implant moves or wiggles during the healing phase, it won't heal properly and it will likely fall out. So what does that mean? Well, it means you're going to have to modify your diet and chew on the other side of the mouth. So if you have an implant on one side, you're going to chew on the other. And I would encourage you to start off by going with very, very soft foods until you train yourself to chew on one side, because it's not natural for humans to chew on one side. So chewing on one side will take a little bit of practice. So you want to kind of start that, preferably before you even have the implant. But if you don't, you definitely want to start off the first few days with a liquid diet, working your way back to a normal diet, but just making sure you don't bite on the implant. What I like to tell people is after 3 weeks, the gums will have healed around the implant, and a little metal cap level with the ground, almost like a manhole cover on the street, will be in the mouth. After 3 weeks, you want to keep that clean. And the way you do that is you take a toothbrush, not one that vibrates, just a regular one, and lightly brush across like you're trying to remove the consistency of mayonnaise. You just want to do that 2 or 3 times, a couple times a day, to keep that little metal cap nice and shiny and clean, so that at 3 months, when the bone is locked onto the implant, you are going to have a wonderful solution and a long-lasting tooth replacement option. Long-term care for dental implants is very similar to natural teeth. In fact, we use all the same regular oral hygiene instruments. You're going to use toothbrushes, you're going to use dental floss. Oftentimes you'll use a floss threader, which is a dental floss with a little piece of plastic that allows you to get it underneath your prostheses, your fake teeth. And also, you're going to use a hydrofloss, which is like a power washer for your mouth. And you're going to shoot the water up underneath the prostheses to help keep it clean. If you do those things and you come in for your regular 6-month checkup, and so that the doctor can check that everything's doing okay and nothing is loose, then you can have a long-lasting solution with very little problems that will allow you to eat and smile for a very long time. People often ask, how long does a dental implant last? In my clinical experience, a properly placed implant will likely go to the grave with you. Now, if there is a problem with the implant when it's placed, and it's not placed in the right location, then all kinds of complications can happen downstream, mostly mechanical. And what do I mean by that? I mean screw loosening, the crown's coming off, lots of cement decementation, things like this. You don't want to have those things in your life. So it's paramount that the implant be in the right location to minimize those things. If you do that, then the likelihood of having a problem with that implant is extremely low. The number one thing that will kill a dental implant, in my clinical experience, is smoking. Smoking is really, really hard on the dental implants. The literature is not 100% clear on exactly why that happens. Most of the time, smoking failures will happen either right away during the healing process within the first couple of months or within the first couple of years. If you get past the first couple of years, then the chances of having a smoking-related issue is much lower. But it's really hard with smokers to get past that initial phase. In fact, in my office, of the implants that have failed to integrate, meaning that they were placed, everything looked really good, but then in a couple weeks to months, the implant had not integrated. The bone had not grown onto that. In the vast preponderance of those cases, the number one common cause, smoking. So what do? We encourage you to stop. We help you in every way, through over-the-counter medicaments to prescription medicaments, to try to encourage you to stop. And if you can, what a wonderful thing. You've stopped the habit. You get to save all that money and spend it on something more productive, like maybe a new fishing boat or a vacation or something fun. So we really enjoy celebrating with our patients when they come back to us and say, look, I was able to stop for this dental implant, but I'm not going back now, and I'm going to save that money and do something really much more productive with that. For 1 or 2 implants being placed, it's very easy to just get a patient numb in those locations, just like you would for a regular filling. If you're doing a full arch, upper or lower or both, then typically with those procedures, we encourage people to consider doing sedation. So we have moderate conscious sedation, which means that you'll be sleepy, you won't remember the procedure. And the reason we do that is you only really have to do this once in life if it's done properly. So we say to people, why would you want to remember the experience? Just go to sleep wrapped in a warm blanket, and when you come to, you'll have a beautiful upper or lower new set of teeth, and you can just go about your life. If you have anxiety or concerns or fears about getting a dental implant, I would encourage you to come by and have a chat, a complimentary chat, and just get to know either me or your clinician at your local town. And the reason is that oftentimes many of those concerns that you have are unfounded. And what I find is that with a simple conversation, we can ask, what is it that's bothering you? And you might say something like, well, I just don't want to hear the process. And we say, well, we have Bose noise canceling headphones we can give you. And they go, oh, wow, that's wonderful. Or they say, I don't want to see the process. And we say, well, we've got these really dark welder's glasses that we use for safety glasses so that it's dark in the room when you're doing the procedure. Or we say, we have options to do sedation to keep you comfortable where you won't remember the procedure. So there's a lot of solutions to the problems that you're experiencing, because a lot of people have those same experiences. They have the same concerns that you do, and we have answers for those. But the starting point is simply coming in and talking to someone about your concerns so that they can be addressed appropriately. Dental implants, when properly planned and properly executed, have extremely low risks. Now, it's important that you understand, properly planned and properly executed is very, very important. If you don't plan, then it's very difficult to have a good outcome. So proper planning, in order to determine what exactly the patient needs, and proper execution, which means on our side, the proper types of tools necessary in order to accomplish that task, together will give an outstanding long-term solution for a tooth replacement option. There are age limitations to getting dental implants. We don't like to place implants in people before they really have completed their main growth spurts. So we're talking about pretty much the end of college time frame. It is possible sometimes to place temporary implants in younger people, and it is possible to actually place permanent ones in there, but it creates a lot of complications, because the body will continue to grow around the implant, but the implant will stay where you placed it. So it may work well now, but as you get a little older, the implant will actually look like it's in the wrong position because everything's growing around it. So typically what we like to do is we like to wait until closer to the end of college ages in order to place a dental implant on a young person. As far as at the other end of the spectrum, really, as long as you're healthy, you're a candidate for a dental implant. So if you're getting up in age, and nowadays, folks, listen, people come to me all the time and they're like, look, I'm 80. I don't need to replace this tooth. And I tell them, look, if you want a replacement, you might live another 20 to 25 years. It's a long time. Our healthcare is getting really, really good, and we can keep people really alive for a long time. So please don't think of your age as a limitation in terms of getting something that you want in order to improve your smile and your aesthetics. Sometimes people say, are dental implants hard to keep clean? And the answer is no. Dental implants are actually easier to keep clean than natural teeth. Let me explain. Teeth are wider and closer together than dental implants. And what that means is that, when you floss between teeth, the teeth are pretty close together. But when you floss between implants, they're typically 3 millimeters apart, which is about 30% wider than what your teeth are. What that means is that as long as you are inclined to try, you can keep it clean very, very easily. So maintaining a prosthesis, a single unit dental implant, or a full arch is extremely easy if you put the effort in. But you do have to put the effort in. Dental implants can be used to fix 1 or 2 missing teeth, or a section of missing teeth, or an entire arch, or an entire mouth. So they're very, very versatile. When it comes to just a single tooth, if you're missing a single tooth, clearly an implant can go in. After it heals, the crown goes on and you have a great solution. If you're missing 2 or 3 teeth that are near each other, then sometimes what you can do is place 2 implants and do a supported bridge like you would normally do on teeth to cover that span. And then if you're actually in the situation where you need full mouth reconstruction, you don't have to have an implant for every tooth. You can get by with as little as 4 implants often and get a lovely solution. It takes about 1 hour per arch. So the upper arch and the lower arch, if you were to do both at the same time, would be about a 2-hour procedure. Dental implants can be used to lock down dentures. If you have a denture and you don't like the way it is staying in place, it moves around too much, you can add 2 or 4 dental implants to help lock it down. Now, you would still use the denture. The denture would snap down on these. Sometimes people call them the snaps. And what will happen is you'll place 4 implants, or 2 in the front, or 4 like a 4-legged chair. Clearly, a 4-legged chair is more stable than a 2-legged chair. So you would say, if I can afford the investment, I'll go with the 4. And if you do 4, your implants will be underneath the denture. The denture will have a little plastic O-ring where all 4 of those implants are, and it will snap down in place and give you a lot more stability than you would have otherwise. When you're getting an all-on-X full mouth restorations on implants, the day you leave, you will be leaving with a set of teeth. But we tell people they're your show teeth. They're to show your friends and family, but they're not to be used. Remember, they're sitting on top of the foundation, which is the dental implants, and the foundation hasn't set up yet. Think of concrete that hasn't set up. You gotta let the implants set up in the bone first. So if you were to wiggle those, the whole thing can fail. So what does that mean? That means you're going to be on a very, very soft diet, if not a liquid diet, for a couple of months, which quite honestly, is probably the biggest challenge associated with a full arch solution. It's not the discomfort, it's not the healing, it's really modifying your diet for a couple of months. If you can commit to that, after 2 months, you're going to have a set of teeth likely that could last a lifetime. So sometimes when you think of it that way, it's well worth the investment. Dental implants are typically broken up in terms of their investment into 2 main parts. The first part is when you get the implant. So that would be the surgical part where the implant goes in. And remember, that is like the foundation underneath the house that's going to support the crown later. The second part is the crown, which is the house. It goes on top after the bone is locked on to the dental implant. In most offices, what they'll do is they'll only bill you for phase 1, which is placing the implant, and then phase 2, which is the crown. Now, the fun thing is that if you're really clever with this, you can actually straddle calendar years with your insurance and try to maximize your benefits. So in our office, we have an insurance specialist that will look at your benefits and try to do everything they can to maximize the benefits for you. When doing tooth replacement options, it's often the case that people aren't planning for it. In other words, they don't sit around and think, I'm going to save money for when I lose my tooth. It's not like that. So most folks will actually come to us and ask about financing options. And financing is a lovely way to move forward with a tooth replacement option. And in our office, we have a multitude of different banks that we work with. And what we do is we simply sit down, talk to you about your needs, figure out a plan that works for you, that fits your lifestyle. and come up with a plan that meets it. And financing is almost always included because, as I said, almost no one is saving money for a rainy day when they inadvertently get a tooth knocked out or a tooth becomes symptomatic. It starts to hurt from an infection. Nobody really plans for that. Those are things we hope never happen, and that's why it's really nice to have the ability to use financing to take care of these things when they happen. When it comes to planning a dental implant, it's very, very important that you look for a clinician that's going to use three-dimensional data. In the old days, when we were young, we used to take two-dimensional data, two-dimensional radiographs at the dental office. And that was all we had. But now we have three-dimensional radiographs and three-dimensional oral scans. Together, that data allows us to plan in a three-dimensional space on the computer. So if we live in a three-dimensional world and we do a surgery in a three-dimensional world, it makes a lot of sense to do your digital planning, your surgical planning in 3 dimensions. If you don't, you're leaving out one full dimension. You could easily say 33% of the data is missing from the plan. And it's really, really hard to do a great job when you're starting at 66%. You're already starting at a D, and that's difficult. It's not that it can't be done, it's just really challenging. So what you want to do is you want to look for someone who's going to do a dental implant using 3-dimensional data and virtual software on the computer that allows them to do virtual surgery. That way you can ensure you get the right size of the implant in the right location for longevity and aesthetics. If you feel like you've been investing in your smile for a long time and you've been following the advice of your dental professional and you seem to be constantly putting money into your mouth, but it doesn't seem to really end, you might be a candidate to talk to someone about dental implants. And the reason is that when dental implants are properly done, many of those problems go away. Let me give you an example. If you have periodontal disease, that's the disease in the gums and the bone, if you have that disease and you have dental implants, that disease is eliminated. You cannot have periodontal disease if your natural teeth are missing. So if we take out the infection, it goes away and it cannot come back. So if we take out the teeth and we place dental implants, you can't get another cavity. You won't need another root canal. You won't need a buildup. You won't need a crown. All of the things that you're probably well too aware of. You probably know way too much about dentistry at this point. All of those things go away. And what you have is a long-lasting, beautiful smile that will function amazing. You can eat anything you want, steak, corn on the cob, apples, and have a gorgeous smile that won't take on stain as long as you brush it every night. It won't even stain. It's so impervious to stains. It's a lovely solution. So don't wait. If you're in that situation, at least come in for a complimentary consultation with your healthcare provider and ask them for options because you might be surprised. And the second thing is, a lot of times, even though it is an investment, you would be surprised that that investment is the end of the road. In other words, you will still have to make some small investments going forward, but potentially nothing like what you've invested up until that point in your smile. And to have a beautiful smile that allows you to function and eat and smile with friends and family the way you've always wanted to, without any concerns, it resonates within the heart and the mind in a way that is hard to describe until you see people after they've had this procedure done.